Welcome to the Elucidator channel. In my last video, we discovered the origin of the coronavirus, how it was engineered and accidentally released into the world. In this video, we will explore this virus in more detail, what it is, why you don't want to be infected by it, and why you will get it. This is a type of coronavirus. Coronaviruses are a large family of viruses that are common in people and many different animals. Animal coronaviruses can sometimes infect people like the original SARS and MERS viruses, causing severe disease. The current virus ravaging the world is known as SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome, Coronavirus 2, and is unlike any virus humans have encountered in the past. It's a new or novel virus and never before seen on the planet, mainly because it was genetically engineered in a lab to be made more infective than any other coronavirus in history. It was specifically designed for the purpose of study, but as we now know, it was accidentally released from the Wuhan Institute of Virology. Humans don't know exactly how this virus works or how to treat it. What researchers do know is that it has a gene sequence that is found in HIV. This is the part of the virus that was incorporated by human hands, and it's this feature that sets it apart from any other coronavirus and has huge implications on its potency, transmissibility, and what it can do in the human body. It is now known that this HIV genetic code gives SARS-CoV-2 the ability to bind with human cells 1,000 times more potently than the original SARS-CoV-1, and that the virus has a unique two-avenue mode of attack on human cells. First, it has an uncanny ability to bind to what is called the ACE2 receptor cells in the human body. ACE stands for angiotensin converting enzyme. These cells are found in our nose, mouth, heart, liver, kidneys, blood vessel walls, and of course the lungs, which is where this virus loves to replicate. With the addition of the HIV genetic sequence, it's also able to attack human cells via the target called furin. In simple terms, it's similar to HIV, making SARS-CoV-2 1,000 times more infective than the original SARS virus or any other known coronavirus. Researchers have found that this new virus has been much more stable in transmission and replication, and it's becoming more virulent over time. It's the general consensus at this point that the virus is not going away anytime soon. It will most likely be with us until a vaccine is made, and a vaccine is a long way off. Scientists have not come up with a vaccine for the original SARS virus or for HIV. Developing a vaccine for SARS-CoV-2 will not be an easy task, and according to experts, will not be available anytime in the foreseeable future. As we live with this virus, every day doctors are learning more and more about it. As it starts to colonize the inside of your mouth or nasal passages at an unprecedented rate, you may lose your ability to taste and smell. It will very soon work its way down into your throat, causing it to become sore. By day 3, the sore throat will get worse as more virus is being replicated there. The infected person may develop a fever, and there will sometimes be intestinal issues as well. As the virus continues to replicate in the body, the fever may get worse, malaise and joint pain may be felt, and the person may feel extremely bad. A dry cough may also develop. According to the CDC, 80% of those infected will experience mild symptoms. By mild they mean, quote, will not need a hospital. The symptoms experienced by most mild cases of SARS-CoV-2 are not like the regular flu. It'll be much, much worse and could last much, much longer. Many of these mild cases will experience weeks of fever or weakness, hallucinations, joint pain, and symptoms unlike any other flu they ever had before in their lives. This is one disease you don't want to experience. If the body's immune system can't defeat the virus at this point, it will move deeper into the lungs. As the virus makes its way deeper and deeper into the lungs, where there are more ACE2 receptors that it craves, the person will start to feel short of breath and will get more and more sick. This will occur in 20% of those infected. That's 1 in 5 people. They will wind up in the hospital for a multi-week ordeal. The virus will replicate in the air-exchanging cells in the alveoli of the lungs, causing them to die. As the body then tries to fight the virus, the inflammatory response will also cause further problems and more difficulty in breathing, which will lead to ARDS, which stands for Acute Respiratory Disease Syndrome. However, it's not the typical ARDS normally seen with the regular flu. Autopsy reports show that in the case of SARS-CoV-2, the main issue in the lungs, besides the damage and inflammatory response, is that there is massive clotting in the lung tissue. It's more of a blood clotting disorder, which is very different from regular flu and much worse. Doctors treating coronavirus disease, which is called COVID-19, which is the disease caused by SARS-CoV-2, are still trying to make sense of it all. In typical ARDS caused by flu, the patient struggles to breathe, and after a while the lung muscles can no longer function on their own as they get tired. The person is seen laboring and soon will need a ventilator to take over the function of the person's lung muscles. But in COVID-19, most patients have no trouble making their lungs operate. They have no trouble performing the mechanical operation of breathing, yet their oxygen levels are extremely low. They don't even realize that they have a problem until they start to feel lightheaded, at which point it's too late for them. Hospitals now are starting to understand that most COVID-19 patients are not like regular flu patients, and the ARDS that they present with is different than normal flu. In fact, treating COVID-19 ARDS with the same protocols, including ventilation protocols, may be causing more damage than good. Trying to force oxygen into lungs that are full of clotting material caused by the virus may be increasing the deaths. 50 to 80% of COVID-19 patients that receive mechanical ventilation die. Besides deaths caused by lung damage and ARDS, clinicians and pathologists are trying to understand all the ways that the coronavirus damages the body besides the lungs. They now realize that the virus attacks humans like no pathogen humanity has ever seen, that many organs can be attacked, including the kidneys, stomach, heart, and brain, which not only are affected by a lack of oxygen from ARDS, but also attacked directly by the virus itself. Cardiomyopathies are frequently being seen, and as the kidneys are abundant with ACE2 receptors, they too are being damaged. Up to 30% of hospitalized COVID-19 victims experience kidney failure. Up to 25% of hospitalized patients need a neurological consultation for brain inflammation, encephalitis, seizures, loss of consciousness, and abnormal brainstem reflexes, which affects how the person senses their own oxygen levels. ACE2 receptors are also present in the neural cortex and brainstem, which would explain these issues. Human blood vessels are also full of ACE2 receptors, which makes people with COVID-19 susceptible to vascular issues and clotting, which occurs in 30% of hospitalized patients. This clotting not only affects the lungs, but also the rest of the body, causing a variety of serious problems, including strokes. Another issue frequently found in COVID-19 victims is what they call a cytokine storm, or the body's overreacting immune response to the virus. For some reason not understood at this time, many people's immune systems overreact to this virus, which can cause many extreme and dangerous issues in the body, such as brain swelling and organ failure. Researchers are starting to believe that there may still be residual virus left within people even after they seem to have recovered and no virus can be detected on testing. And reinfections of the same person are starting to be seen. So even if a person feels recovered and tests negative for the virus, it doesn't mean that they're out of the woods and may re-experience the sickness in a few weeks, months, years, or decades, depending on the status of their immune system, and other factors like the development of diabetes, obesity, or high blood pressure. And in other people, the disease state seems to cycle from getting better to getting worse and better again for months. During this time, the virus may start to affect different parts of the body, giving the victim many long-term, permanent, and insidious chronic problems. A person may never know where or when they will get hit with a clot, heart myopathy, liver issue, or other significant problem. Scientists think this is because the virus is able to infect human cells so aggressively and perfectly that once infected you may not be able to completely get rid of it. Much like the chickenpox virus that always persists in the human body only to re-emerge years later in the form of shingles if it's triggered through stress or other physical issues. Virologists feel that this may be a killer, that once it gets inside of a human body will never let its victim off. Even in those that have so-called mild symptoms and didn't need to go to the hospital, this is not like the regular flu. Many victims that are classified as mild cases, which according to the CDC means that they did not require a hospital, will be left with permanent debilitating damage, such as a reduced lung capacity or cardiac damage requiring a pacemaker. More and more scientists now believe that in people who have initially experienced mild cases, this virus may remain dormant in the body, only to come back at some future point to cause more serious problems. This virus is so dangerous that your body will need to be functioning as well as it can to be able to withstand its onslaught. Any medical issues such as diabetes, advanced age, heart disease, coronary artery disease, obesity, high blood pressure, or autoimmune disease will put that person in a distinct disadvantage when it comes time to defend against this virus. SARS-CoV-2 is perfectly designed to be the ultimate infector. It can live on surfaces for anywhere between a few hours to a few days, depending on the surface. It can remain in the air for as long as an hour or two once it's sneezed or coughed out. If you touch an infected surface, then touch your eyes, nose, or mouth, or if you inhale the infected breath of a person speaking to you, or the particles from an infected person's cough or sneeze, you will introduce the virus into your body, and at that point, your trouble will begin. And if you are unfortunate enough to inhale the particles ejected out of an infected person's sneeze, you will get a very large load of virus particles directly into your lungs, in which case you will have a more severe disease, which will progress even faster. An infected person can sneeze on a subway car, get off at the next stop, and new passengers entering into the car will become infected. So next time that person next to you sneezes, don't be so eager to bless that person. This virus is so contagious, and the load of virus found in infected people is so high, that an infected person can infect another person just through talking. The virus is known to be able to infect the occupants of individual apartments and apartment complexes that are sharing the same piping and air ducts. The infection rate on cruise ships, where passengers strictly quarantine themselves in their cabins, is so high that nearly everyone on a contaminated cruise ship will become infected. You can't escape its grip. Even more insidious is that unlike the regular flu, where symptoms show up within 1 to 2 days after being infected, those infected with SARS-CoV-2 can show no symptoms at all for 7 to 20 days after being infected, and they can spread the virus all throughout this asymptomatic period. In other words, an infected person can feel totally fine for at least a week, continue to go to work, hang out with friends, take public transportation, and the entire time be infecting others with a virus that no person has an immunity to. This means that even if you were to take the temperature of a contagious person, they can still read as being normal. SARS-CoV-2's genetic makeup makes it more infectious than any other flu humanity has experienced, including the Spanish flu of 1917. The United States' preeminent research facility, Los Alamos Labs, wrote a paper concluding that the R naught, which is the mathematical term that indicates the infectiousness of a disease, is at least 6 for SARS-CoV-2. Regular flu has an R0 of 1.2 or 1.3. Swine flu had an R0 of 1.5. The Spanish flu had an R0 between 1.4 and 2.8, making SARS-CoV-2 many more times infectious. This means that eventually everyone in the world will be infected with SARS-CoV-2. It is mathematically unavoidable. Its infection rate is higher than any other flu virus ever seen. There is zero immunity towards it, and no vaccine on the horizon. Dr. Fauci himself said that he has never seen a more contagious disease in his entire life, except for perhaps the measles. Scientists expect this virus to rip through the world like the wind, with nothing to stop it. No matter how many precautions you take, eventually you will be infected. It's just a matter of time. Remember, although many will have little to no symptoms, many more will experience the worst flu symptoms of their lives. 20%, that's 1 out of 5 of those infected, will need a hospital bed. And the current case fatality rate worldwide is about 6.8% according to the most recent data. Compare that to the case fatality rate of regular flu, which has a case fatality rate of 0.1%, which makes SARS-CoV-2 at least 50 times more deadly than the regular flu. In the United States alone, there have been 80,000 deaths so far from COVID-19, and that's with a countrywide lockdown and mitigation, and the best, most advanced and abundant healthcare system by far in the world. And as the rest of the population becomes infected, there will be many, many more deaths to come. Recently, there has been a lot of talk about how the death rate of the virus is actually not as bad as we thought, and more in line with the regular flu. The reasoning for this is that there are a lot of new studies that show that many more people are infected with the virus than previously thought, which would change the ratio, making the virus less deadly than first realized. This is not correct. What's happening here is that they are conflating the infection fatality rate with a case fatality rate. They are not comparing apples to apples. The infection fatality rate is the ratio of deaths divided by the number of actual infections present in the population. With this new data showing that the virus is much more widespread in the population than previously thought, they now estimate that the infection fatality rate for SARS-CoV-2 is around 0.5%. They are conflating this with the case fatality rate, which is the ratio of the number of deaths divided by the number of confirmed cases in those cases that we know the outcome. The case fatality rate for this SARS-CoV-2 is still 6.8%. In contrast, the infection fatality rate of regular flu is 0.01%, and the case fatality rate for the flu is 0.1%. To simplify, the infection fatality rate of SARS-CoV-2 is 0.5%. The infection fatality rate of regular flu is 0.01%. The case fatality rate of SARS-CoV-2 is 6.8%, and the case fatality rate of regular flu is 0.1%. No matter how you look at the data, including the data from the new studies, SARS-CoV-2 is at least 50 times more deadly than the regular flu. You can look at it another way. If these studies are correct, and that as much as 6% of the United States has already been infected, which would amount to 20 million people, and if 80,000 of these people have already died from this disease, then that means that if the entire population becomes infected, which they eventually will, then at least 1.3 million will die from this virus using the data from these new studies. No matter how you look at this problem, it's much worse than the regular flu. The CDC predicted that as many as 1.8 million people could die from SARS-CoV-2. This is why the United States entered into mitigation procedures. The hospital system could not take such a large load of patients in such a short amount of time, hence the term flattening the curve or blunting the exponential infection rate of this virus. As mitigation starts to end in the United States, infections will undoubtedly increase again, but there is little choice, as you can only shut down a country for so long until the shutdown causes more problems than the disease itself. As the economy gets crushed by the lockdown, the poverty created by this is causing many deaths. Deaths from suicide, depression, drug abuse, and alcoholism. Deaths are also coming from the lack of availability of routine medical care. Preventative medicine is shut down. Eye exams are not available in areas that are locked down. Dentists are not doing routine exams, and many necessary surgeries are being delayed. It is getting to a point where the mitigation is becoming counterproductive. The spread cannot be stopped. Keeping the country locked down to stop the spread was never the proposed plan. The idea was to slow the spread, which has been achieved, and can be maintained by proper social education. Our hospitals are not being overwhelmed, not even in New York City. At this point, it's necessary to open the country back up to reach the goal of achieving herd immunity. This will be the only way to defeat the virus. Everyone will eventually get the virus. There is no reason to destroy the economy in the process. Many state governors and local mayors are using this epidemic and the fear caused by it to push their liberal and socialist agendas, trying to concentrate their own power while weakening and making the population more dependent upon them. This is wrong and should be watched carefully. The Constitution of the United States should always remain sacrosanct. To have our rights reduced or eroded, in the end, is more dangerous than the virus itself. An interesting case is Sweden. The government did not impose extreme mitigation procedures, yet their deaths per 1 million is less than that of the UK, Italy, and Spain. This may have something to do with the Swedish lifestyle, or their hospital system, or the fact that although the government is not mandating strict mitigation, the Swedish people have taken it upon themselves to take precautions on their own. Also, it seems that getting outside, breathing fresh air, and getting sunlight is beneficial rather than staying indoors for extended periods of time. Sweden understands that there's no way to stop their entire population from becoming infected, but with their current plan, which many have termed mitigation light, they are still able to protect the functioning of their hospital system, allow for the natural progression of their entire population becoming infected, and once herd immunity is achieved, they can go back to their normal lives with their economy still functional. As for getting infected, in my opinion, it would be prudent and advisable to try to avoid being infected for as long as you can. As time goes on, humankind begins to understand this virus more and more. Doctors and medical centers will slowly learn the treatment protocol and implement them, but this will take time. They must change their treatment paradigm and put it in place as they are learning every day that you cannot treat this disease like the regular flu. Although there is no cure and no vaccine, in time, scientists and doctors will learn more and more how to treat the symptoms and blunt its attack on the human body. It will take time for medical systems to change their treatment protocols and adapt to this new enemy. Doctors must learn how to adjust ventilators properly and find other less invasive ways to get oxygen into the blood. They must be on the lookout for clotting issues. They must be made aware of cardiac, kidney, liver, and brain issues associated with this virus, and must become more knowledgeable and willing to prescribe an array of medicines, old and new, and hope for new medicines yet to be developed. Some new treatment options are being developed around the world. In Hong Kong, researchers have just found what may be a winning combination of antiviral drugs to treat mild to moderate cases of COVID-19. These drugs are interferon beta 1b, lopinavir, which is used to treat HIV, and ribavirin, used to treat hepatitis C. Rutgers University in New Jersey has launched clinical trials of the drug EDP 1815, which shows promise in helping to control the cytokine storm issue of COVID-19. The highly touted drug remdesivir shows promise in shortening the time to recovery. However, in its latest clinical findings, the overall death rate is still the same with or without it. The media is nevertheless promoting this drug for political reasons, as it costs $1,000 per dose. And there is a lot of promise with the drug hydroxychloroquine. It's certainly a game changer when treating the virus, showing incredible results in the large French study that was just published. However, due to political circumstances, this medicine is being downplayed and discouraged. Recently, the media has greatly publicized the VA study where they tested a small sample of veterans with hydroxychloroquine. The media reports that in the study, those that received the hydroxychloroquine had a slightly greater death rate than those who did not, and discouraged the public to consider it as a viable treatment. What they did not tell you is that in the study, only those that were in the most severe stage of the disease and those who were no longer able to breathe on their own were the only ones that received the drug. In other words, only those that were basically already dead were given the drug. And as all doctors would tell you, antiviral drugs only work when given early enough in the disease to make a difference. If you wait until the lungs are damaged beyond repair, nothing will save you. And this is why the study showed that those who received the drug had a higher death rate. They were basically already dead when given the drug. When the liberal media omits a crucial part of a news story to promote an agenda and to deceptively influence people's minds, this is the very definition of fake news. This is just one of countless examples that the American people are criminally subjected to each and every day. A free society depends on truthful, honest, independent, and objective information to base their decisions on. Without it, democracy dies, making fake news, not real news, but fake news, the enemy of the people. It will take time for the studies to definitively prove its efficacy, at which point it will be more accepted and more lives will be saved as a result. In our next video, we will explore the truth behind hydroxychloroquine, as well as other treatment options for this disease. In the end, this engineered virus that was released upon the world by an incompetent communist government is a plague and a problem of incredible proportions. The incompetence of a country thousands of miles away is affecting the lives of every human being on the planet. It's the worst thing that many of us have seen in our lifetime. It's a problem that will be with us for a long time to come. As time goes on, more and more people will become sickened by SARS-CoV-2 and will develop COVID-19 disease. There is no place to hide from it and nowhere to run. Everyone will, at some point, become infected within the next year or so, no matter how many precautions are taken. It's just the nature of the beast. The only question is, how will your body deal with this insidious invader, and what your outcome will be? And it's this unknown that is probably the most frightening part of this pandemic. Thanks for joining us for this episode on the Elucidator channel. If you like this video, please hit the like button, and don't forget to subscribe so that you can be elucidated by future videos on this channel. Thank you, and be well.